The clotting cascade is a system in our body that uses proteins called factors that work together to stop bleeding. One of the main goals of the clotting cascade is to produce more thrombin, a powerful protein that helps form a stable clot. A person who has a bleeding disorder is missing one of the important factors needed to make thrombin. Without thrombin, bleeding cannot stop. The clotting cascade has a system of checks and balances to make sure that there is not too much bleeding or clotting. Missing proteins like factor 8 and 9 can be added into the body to stop bleeding. You can also take away proteins that put the brakes on clotting, such as tissue factor pathway inhibitor, TFPI, which is the focus of this video. When you have an injury or bleed, factor 7 attaches to tissue factor, which then activates factor 10. This means that factor 10 changes into a form that allows it to work to stop a bleed as part of the clotting cascade. Your body is also able to control clotting. One way is by releasing TFPI, which is a protein that prevents blood from clotting too much by stopping the early stages of the clotting cascade. This happens when TFPI attaches to factor 7A and factor 10, which prevents the clotting cascade from continuing. Medications called rebalancing agents are a different approach to prevent bleeding. They work by reducing the activity of TFPI so that thrombin can be created, which helps to prevent bleeding episodes. One example of a rebalancing agent is called Anti-TFPI. Anti-TFPI is a protein called an antibody that is created in a lab. The antibody is shaped like a Y. One arm of the Y attaches to TFPI and prevents it from attaching to factor 7A and factor 10. This lets the clotting cascade continue so that thrombin can be made. As with any treatment, there are benefits and limitations. Some benefits of using anti-TFPI are: it can be used for people with hemophilia A or B, with or without an inhibitor. This treatment is given by subcutaneous injection, sub-Q, just under the skin. There is a steady state of activity, instead of the peaks and troughs that people who take factor replacement therapy experience. Some limitations of anti-TFPI are: it is possible for unwanted blood clots to happen. It is used to prevent bleeds, not to treat them, so other treatments will still be needed if there is bleeding or before surgery. Factor 8 or 9 levels are unchanged, which means they remain below the normal range. There can be challenges with checking medication levels since you are not replacing a specific factor, which is easier to test. Anti-TFPI technology includes both benefits and risks beyond what is shared in this video. This may change over time as more data becomes available. It is important that you have a thorough conversation with your healthcare provider to determine which treatment is best for you. This video is brought to you by the National Bleeding Disorders Foundation.